Good evening, Twin Cities. This is your host, Clarence Jones of Community Health Dialogue. I again just thank you for being a part of our show. And tonight on Community Health Dialogues, we have Ms. Shandy Potes Mangra. I hope I'm saying that right. I said it kind of slow, so you can correct me if you like. And she's with the Angel Foundation. And interesting enough, I just had the opportunity to be made aware of Angel Foundation, what they're doing very, very recently, and had the chance to talk to Shandy, and was truly impressed with her in terms of her desire to really help our community. But she's going to talk more about herself, a little bit about herself, where she's from, those kinds of things, but also she's going to share information with our community about the Angel Foundation. And so I think you'll be in for a great treat. And we want to make sure that you get the opportunity to learn about this foundation, and if there are ways in which it might be of benefit to you or to others in the community, we want you to know. So welcome, Shandy.
Thank you, Clarence. Thank you for having me on.
Well, it's my pleasure. And as I said, and I'm not ashamed to say it. I thought you were very, very impressive. Even though you told me, you said you were very new at your position. You seem like a pro, like you've been doing it for a long time. And so what I'd like for you to do for our community, first of all, is to share a little bit about yourself, but then to tell us about the Angel Foundation.
Yeah, absolutely. Thank you. I take that as a compliment, Clarence. I just really appreciate that. So a little bit about me, as I grew up mainly in Minnesota for most of my life. I emigrated here when I was 4 with my family. I originally was born in Panama, which is in Central America, to a mother that was Indo-Guyanese and a father that was half Filipino, half indigenous Panamanian. And all that to say that I grew up mainly in the south suburbs. So I've been in Minnesota for most of my life. I have most recently resided in South Minneapolis for the past 5 or 6 years. After attending the University of Minnesota. That's kind of what brought me to the metro, the Twin Cities. And after my sort of 4-year degree, I got at the University of Minnesota, graduating with a degree in sociology, poli-sci, and global studies with an emphasis in Latin America. I had a lot of interests and work experience working in healthcare for the past 10 or so years. Really had an interest in working direct care roles and learning about people's experiences and the chronic illnesses and different health concerns that folks had, and recognizing that there were a lot of inequities in our healthcare system. And a couple years after my undergraduate, graduating with my bachelor's, I went on for my master's actually in global public health at the University of St. Catherine. And that kind of actually, I would say, is the reason, alongside my work experience, has led me to my current role with the Angel Foundation as a community health equity and community outreach manager, which is a very significant role for me. It's kind of just the beginnings of my career, but I have had experience, again, working direct care roles, which included being a certified nursing assistant in assisted living facilities and in-home care, working as a community health worker for some time in the for-profit healthcare company, and also working in the St. Paul public school system and as a health assistant. So I definitely have various experiences in which I was able to interact with many populations, many folks from different walks of life.
Well, that's quite interesting. I mean, when we first talked, I didn't know that you had that extensive kind of experience. I knew that you had a great interest in healthcare, and so I really want to applaud you. You said you were kind of a community health worker in a public or in a private organization or something of that nature.
Yes, that's correct. I was working as a community health worker for a for-profit company based in St. Paul, and that experience really lent insight further insight, I worked a lot with one-to-ones, helping out on different health issues, actually working with maternal child health, working with folks that were in treatment substance use facilities, and really learning about folks' experiences and their stories, and recognizing just how difficult accessing healthcare can be from various perspectives, as well as leading health promotion classes around talking about mental health, talking about chronic diseases. Really lent itself to the work that I do now. In my role, I pretty much am connecting, it's about connecting to community,
Sure.
And letting them know about the resources that Angel Foundation has to offer.
Well, that's great. I'm really glad that our community is getting the chance to know you. You are what I would call a treasure in our community. And when I talk about a treasure, I'm talking about people that have been exposed to a lot of the experiences of the community, are aware of the various systems, but also somebody that could be a positive gatekeeper, giving people access to the services that are available. And I think that's what I thought about you when we talked about the Angel Foundation, was that here was a foundation that could be of great assistance in our community, but very few people that I know of know about you. And so I think it's important to, at this particular point, knowing that you have all this extensive experience and that you have this awareness and sensitivity to the issues that we are confronted with, and that you're doing DEI work. So tell us about the Angel Foundation, how it got started, and just a little bit about your mission.
Yeah, absolutely. So Angel Foundation, really has been around for actually over 20 years, and it's not surprising, Clarence. Often we do hear from folks that have never heard of Angel Foundation until ultimately they need our resources, and Angel Foundation provides both financial assistance, education, and social emotional support for families that are going through a cancer diagnosis. So an adult in the family that has cancer diagnosis. And we've been around for about 20 years. And the origins of the story really start with a woman by the name of Margie Sabarov, who had a high school sweetheart actually die of leukemia in high school. And it set her on a lifelong journey alongside one of her high school sweetheart's friend at that time. They ended up being married, and they spent their career helping to support cancer patients, both as Margie's husband, Mark, being an oncologist. He went on to pursue that career because of that experience. And Margie became a patient navigator, if you will, a patient advocate.
Okay.
Back when it wasn't very well known. So it's and she noticed the circumstances in which times patients found themselves in, trying to figure out whether they'd have enough money to both take care of their health, their healthcare needs, the ability to pay for their treatment, as well as to meet their needs of household expenses and food, and the sacrifices that families often had to face. Margie saw that as a need, and then took place. Angel Foundation came into existence. Just a little bit of seed fund, originally from Minnesota Oncology, but we have since been working with many healthcare systems, and oftentimes a lot of our referrals actually come from healthcare systems. And wherein my role lies is really connecting to community, where it hasn't been something that Angel Foundation has done directly, and just it's really fortunate that I'm in this role, because now we are wanting to connect more to where people are. We want to get the word out. We know that sometimes people are missed within the healthcare system. Oftentimes the safety net is not provided for all folks, and so it's important for us to be able to meet people where they're at, to be able to provide this information about what we do. So kind of speaking a little bit on that, Angel Foundation has 3 main programs that we provide. The first one is most significant to families. Oftentimes the main reason why folks hear about us is that we provide emergency financial assistance, which is really just a one-time grant that we provide to meet basic household expenses, such as your mortgage or your rent, your phone, utilities, food, anything that's non-medical. And that oftentimes with that program, we have other programs that are connected to it. We have oftentimes adults that have families that are with young children up to their teenage years. We provide educational tools to help families talk about their cancer diagnosis with young children, something called angel packs, which we'd had in the healthcare systems, and they were the ones distributing it. But now we are actually working towards being able to ship it out to homes, to individuals that are requesting these angel packs. Again, they provide medical play, they provide guidebooks, and activities for families to be able to interact and talk about the cancer diagnosis in a way that's age appropriate and manageable for the family. Additionally, we have something called our adult and family programs, and this program allows for families to be able to spend time with each other in a way that they don't have to be thinking about the stresses of cancer treatment and how tired or how much cancer really just takes a toll on the family, right? And so the example of we call making memories. Some examples are we've had families out to Grand Slam. We've had families out to baseball games, to the state fair, sort of pre-show, some other events as well, many, many more. And we're always looking for, that's another aspect of the role in which I serve, is not only just to get this information out to the community, but also to be able to be informed by the community, to hear what the needs of the community are in terms of our programs even relevant to certain communities. We have to be very mindful of that. Is the way in which we talk about cancer, when families are talking about cancer to younger children, is it appropriate culturally as well? So we're really taking into account a lot of that. And in the next few years, we're hoping to have more input through community surveys and focus groups. Oh, Clarence, I think you're muted.
Oh, I'm sorry. I technology is sometimes a challenge for us older people. But anyway, I'm really excited about the things that you're saying, because I think it's very, very important for people to understand that often they feel like they are alone in this work, and they feel like there are no support systems out there. Mm-hmm. And so the role of community health dialogue, as well as other organizations, is to make sure that we uncover treasures like yourself and to make sure that the community knows what's going on. The thing that's interesting to me, as you said this before, and I'm not harping on this, it's said 20 years. I've seen the angel logo around, but I've never had anyone talk to me like you're talking to us now about what's going on. So let's take a theoretical family who might be approaching the Angel Foundation for support. What would be the circumstances, the situation? Just give me a kind of a broad overview so people might have an idea about the kind of way in which they might intersect or interface with you. And yeah, I remember you said that most of the work has been done through healthcare facilities, hospitals, those kinds of things. But what would be an example of something that a person would interface with you?
Yeah, so often enough, it's usually been referrals through healthcare systems that folks have heard of Angel Foundation. Upon hearing about their cancer diagnosis, they might be referred to a social worker that helps them apply for our program. But they can certainly, and oftentimes there's also, we hear word of mouth is often the case as well. People hear about us or they search for us online and find our resources. But it's always usually at the time that they're most in need, and our hope is that we get the word out so that folks know about Angel Foundation if it ever comes up. And we know that, statistically, I think one in four individuals will get cancer within their lifetime. So this, almost everybody in the community knows somebody whether it's within their own family or their network that has had cancer or is going through cancer treatment. And so the ways in which they can connect with Angel has unfortunately just been through the healthcare system, but we're working on being more present in the community, which means attending community events where we know that's community member led, that oftentimes is very engaged with the needs of the community and brings resources out to help address some of the healthcare needs. And so we're certainly, I'm making it definitely a point to be out at several events this summer to be able to get the word out, because, it's really unfortunate to hear, sometimes when people say, who's Angel Foundation, even though we've been around for such a long time. I'm not surprised by that, but I am happy to be fortunate to be in this position so that I can spread this resource as a really pivotal resource to folks.
Well, I appreciate that. Like I said, a lot of times when we uncover or we discover new organizations that are out there, it's like, well, why didn't it happen earlier? But, we get in where we can fit in, right? When we find out there are organizations that are really trying to make a effort to reach the community and trying to make an effort to provide services to the community, those of us who have this platform have the responsibility, I think, to as much as we can to share this information. A couple of things that you said that I thought was quite interesting. Number one, you want to get out into the community, and this is a community health fair season. I can tell you already we have at least 11 major health fairs, not only in the African American North Side, South Side community, but also the Latino community, the Somalian community. I mean, we've already got those things lined up, and a great place where you might be able to connect with. And so I'm more than happy to share those things with you. But you also talked about this angel pack and things like that. Tell us more about that. And why I'm asking that particular question is that I know that you send them out specifically to families that have requested them, right?
Yes.
Okay.
Yep.
So,
right.
But the other thing that I think is would be interesting or would be informative is to when you come out, do you bring angel packs to display for folks so they can see what it is?
That's all great questions, Clarence. Yeah, we try to bring out our angel packs when we are tabling at events, which have been very frequent because as nonprofits it goes, it can be very difficult to have a person specifically in this sort of position that I'm in to be able to provide that community outreach. And so but in the past, we have tried to bring our angel packs out to be able to share the messaging, but also to show. And our angel packs are actually going under revision. We are working on improving them and making them even better than they already are. But there's not that many. There currently really isn't a lot of angel packs or materials in which families can be provided with a guidebook that helps talk to families, young children about cancer. So it's we feel very fortunate to have this sort of wonderful resource to be able to share out with communities. And again, we are looking at, in future, trying to make sure we have angel packs that are culturally appropriate, because as we know, as you mentioned, Clarence, there are so many communities in Minnesota, in the metro area. And so it's really important that we are taking the community feedback and being able to apply that to the packs that we hope to continue to revise.
Right. Like I said, I think that, when you talk about what you're doing, it excites me. It excites me because, number one, there are some communities that are very, very visual and they have to see it. And, I'm thinking that, if there were samples, not samples to give away as much as samples to that people see what they're like, it would be of great interest. I think a lot of times too, as we were talking about cancers, one of the things I am an African American male, and so one of the things that really one of the cancers that really I shouldn't say frightened me, but that's not the word I want to use. But one of the that shouldn't say overwhelming either. But one of the conversations that I have a lot with men is around that prostate cancer. So do you find that there have been examples. Do you have an example of men who might have prostate cancer, how Angel Foundation might have helped them?
Yeah, thanks for bringing that up, Clarence. It's actually it's interesting that you bring that up, because what we when we're looking at our participants in terms of just who are the folks, and Angel Foundation actually serves all types of cancers. So you're bringing up men with prostate cancer, and their journey, and we overwhelmingly get female participants or clients that come to us needing financial assistance, and so it is primarily women that we see, and so that kind of lends a story in itself, right, Clarence, of
Right.
the narrative of men not maybe not reaching out for help because they either don't know about the resources that are out there, or there's definitely a culture of not wanting to ask for that help, certainly. And but how we would support the men who have gone through prostate cancer, which are many, because there's, of the top cancers we often get, it is breast cancer, lung cancer, and prostate cancer, which are statistically the most common cancers as well. And we, oftentimes we see men with prostate cancer coming through with the need for financial assistance, emergency financial assistance.
Right.
More so than some of our other programs, which again is the primary reason that folks come to us, is just that really the need for financial support.
Right. And go ahead. I'm sorry.
Oh, sorry, Clarence. It brings up to mind, though, that I think what would be something that we are hoping to improve upon is our sort of our support programs. I mentioned adult and family programs, where we do have events that we allow, that we give out tickets for events for families to have that bonding time. And I think there's more for us to look into when we talk about men and what are the needs that they have. Thankfully, we actually have an individual who is on our diversity, equity, and inclusion committee, who identifies as a male, and he has a cancer experience, and he talks about how important it is, like if there had been a support group where people looked like him, or activities in which there were other people that looked like him, that he would be more likely to participate. And so that we keep that in mind as we're moving forward and thinking about new activities and events for cancer survivors to attend.
Well, I want to thank you for how you approach the question, because one of the things that happens sometimes when people recognize that there has been a deficiency or lack of energy towards certain types of topics or people, that they kind of get defensive. And I appreciate the openness that you have in terms of talking about this, because this is what's so important for me in terms of talking about treasures in the community. People need to be able to understand that there are so many things that are going on that now have been exposed. There are ways in which we might be able to help individuals more, and when we come across those things that are very sensitive in terms of the fact that we haven't approached them, then we need to be okay with that. We need to be able to talk about it and understand that we're learning, and there are people like you in those positions that can help us to not only continue the conversation, but have the conversation in a way in which we can really make a difference in our community. So I want to thank you. I'm not trying to pump you up, really. I'm not.
Thanks.
I'm not. I'm trying to pump you up. I'm just trying to say that I get excited when I meet people like you that I believe are authentic and that really care about our people and care about our community. And so I want to thank you, though, for the time that you have spent with us and sharing more about the Angel Foundation. And I know that I'll be in contact with you. What is the contact information for someone who might be listening that might want to contact you for further information?
Yeah, I'd love to share my information. I wonder, Clarence, if I have time, I want to mention two other things before.
Okay, sure, go ahead.
The first one I wanted to say is kind of going back to the Angel Packs and to the Making Memories activities that we give out tickets for. These are all things that we, any grown up in a household, we know we have families that are made up of grandparents, aunties, uncles, siblings living in the same household with young children. if any adult within that household has cancer, we support the entire, we support that entire family. So if an angel pack is necessary for someone's, for an auntie's nieces and nephews, we will certainly be providing those angel packs. So I would just want to make sure I stress that. For grandparents as well, we would want to give angel packs out as well for those.
Okay.
The second thing I want to mention, Clarence, is that we have a DE&I forum coming up on June 23rd, Thursday, from noon to 1. And it would encourage folks to listen in if they're curious, to learn more about clinical trials and just how important it is to have representation from racial and ethnic minorities, as well as from different other groups that are not being represented in clinical trials. So to learn more about that, to come to that forum, which will be virtual, June 23rd.
And what's the contact information for that, or the website, or what number can they call?
Yeah, so to go to our website, it's mnangel.org. If you want to connect with me to hear more about, or you have more questions about what we talked about, you can reach me at SPOTESMANGRA@mnangel.org, or you can direct call me in the office here. It's 612-395-4598.
Well, Shandy, I want to thank you. I mean, I think that we should have a lot of our listeners who might be have a great interest in what you're doing in the Angel Foundation. And I know that we will be contacting you and trying to get you to share with us your information at these health fairs that we're out there, because there are many people in our community that are suffering and struggling with cancer and the aftermath of that. So thank you again for your time with us. And listeners, I want to thank you for listening to Community Health Dialogues. We will talk with you again next week. Have a great evening.
Thanks, Clarence.